Thank you for joining today's presentation on what's new for the National Prescribing Indicators 2025 to 2028. My name is Shayla Ahmed and I'm a pharmacist at AWTTC.
Hi, I'm Catherine Chaplin and I'm a Senior Scientist at AWTTC.
So in this session, we will cover the background and development process of the National Prescribing Indicators, as well as introduce the new indicators and key updates for the NPIs for the 25 to 2028 period. My colleague Kat will then take you through the new Spiral online antimicrobial dashboard. So what are prescribing indicators? They're tools endorsed by the All Wales Medicine Strategy Group, AWMSG, to promote rational prescribing across NHS Wales. These evidence-based indicators highlight therapeutic priorities and allow health boards, GP practices and prescribers to compare their current prescribing practice against an agreed standard of quality. The indicators aim to drive positive change, and the data can be used for benchmarking both within Wales and against England. The NPIs are developed by the All Wales Prescribing Advisory Group, ORPAG, with a review every 3 years. And for 25 to 2028, the process included a stakeholder survey, subgroup review and consultation, with final endorsement by AWMSG in November. The NPI 25 to 2028 document, available on the AWTTC website, provides detailed background and evidence for each indicator, along with health board level data, while the supporting information for prescribers and healthcare professionals document offers a concise summary of each indicator, including units of measure, monitoring purposes, suggestions for implementing changes, and links to relevant resources. For the 25 to 2028 NPIs, there are 4 priority areas supported by safety and efficiency domains. These priority areas are outlined on the slide, and we will go through each of them in more detail during the presentation. Key updates include the retirement of anticoagulant indicators in atrial fibrillation, the introduction of new SGLT2 inhibitor indicators for both diabetic and non-diabetic patients, and the inclusion of SAB inhalers and a new priority area called respiratory. The safety domain covers safety indicators, hypnotic analytics, and yellow card reporting, while the efficiency indicators include best value biological medicines and low value for prescribing. So the first priority area is analgesia, which includes opioids, high-strength opioids, tramadol, gabapentin, and pregabalin. For opioids and high-strength opioids, the unit of measure recently changed to oral morphine equivalents, OME. And an OME Spiral dashboard is available on the AWTTC website, providing data at various levels to assess how well your health board, cluster, or practice is performing. The indicators support the Welsh Government's Living with Persistent Pain guidelines, and additional resources, including the All Wales Pharmacological Management of Pain guidelines, can be found on the AWTTC website to further support this area. The next priority area is antimicrobial stewardship, which includes 3 indicators. The first 2 are total antibacterial prescribing and the 4C antimicrobials, which includes comaxiclab, cephalosporins, fluoroquinolones, and clindamycin. The unit of measure for these indicators has been updated to include defined daily doses, DDDs, in line with the UK's National Action Plan for Tackling Antimicrobial Resistance, which aims by 2029 to reduce total antibiotic use by 5% from the 2019 baseline. And to support this area, we have the AWMSG antimicrobial guidelines, which are updated regularly. Also, the recently endorsed AWMSG backup antibiotic prescribing guidance, as well as numerous audits available on the AWTTC website. The third antimicrobial indicator is a new course duration indicator for antibiotics prescribed for acute respiratory tract infections. And this has been introduced as guidelines recommend prescribing the shortest effective course to reduce the risk of antimicrobial resistance and adverse effects. Current data shows variation across health boards, highlighting the need to reduce unnecessary long antimicrobial prescriptions, which is a key part of the UK National Action Plan. To support this, AWTTC have collaborated with the All Wales Primary Care Antimicrobial Pharmacy Group to develop key course duration messages using ScriptSwitch, a prescribing decision support software used in primary care. We're also working with OptimizeRx to create similar messaging for further support. Moving on to the next priority area, which is respiratory, and there are two key indicators. The first is decarbonisation of inhalers, with the target for the 25 to 2028 period being to increase the proportion of low global warming potential inhalers prescribed to 80%. And when initiating a new inhaler, consideration should be given to prescribing a dry powder inhaler with low global warming potential, provided the patient is able to use the device safely. The indicator aligns with the aims set out in the Decarbonisation, Inhaler Prescribing Use and Disposable National Strategy, as well as the NHS Wales Decarbonisation Strategic Delivery Plan. The other indicator under the respiratory priority category is short-acting beta-2 agonist inhalers. This is a new indicator and aims to reduce the over-reliance on SABA inhalers to improve asthma control and asthma-related health outcomes. Overuse of SABAs is associated with increased asthma-related healthcare costs, a higher risk of asthma attacks, and greater hospitalisation rates. Reducing SABA overuse through better asthma management could help lower these risks. And to support with this, the All Wales Asthma Management Guidelines are available on the AWTTC website. Additionally, reducing SABA reliance will contribute to reducing carbon emissions from SABA MDI inhalers, supporting the NHS Wales Decarbonisation Strategic Delivery Plan. The final priority area is SGLT2 inhibitors, with 3 new indicators introduced for both patients with and without type 2 diabetes. These indicators aim to increase the proportion of individuals with type 2 diabetes and chronic heart failure, as well as those with and without type 2 diabetes and chronic kidney disease who are prescribed an SGLT2 inhibitor. This aligns with the UK Kidney Association and Kidney Global Outcome Guidelines. There is strong evidence supporting that SGLT2 inhibitors slow the progression of chronic kidney disease and reduce the number of cardiovascular events and end-stage renal disease. Due to the withdrawal of Order Plus, feasibility testing for these indicators has not yet been possible. However, we are now looking into this following the proposed extension of Order Plus until March 2026. For the 25 to 2028 period, the changes to the safety indicators are highlighted on the slide. 2 new safety indicators for antimicrobial stewardship have been introduced. Trimethoprim is now a safety indicator due to high incidence of resistance when used as first-line treatment in the elderly. Similarly, nitrofurantoin is added as safety indicator because it's contraindicated in patients with eGFR below 45 ml per min, where it may be ineffective and contribute to antimicrobial resistance. Topiramate has been included as a safety indicator following a recent MHRA drug safety update, which highlighted increased risk of congenital malformations and low birth weight when used during pregnancy. 2 prescribing safety indicators will be amended. The safety indicator for asthma patient prescribed a beta blocker will now include only non-cardioselective beta blockers, and the sodium valproate indicator will be modified to include male patients, following the MHRA update advising against initiation in those aged under 55 due to the risk of impaired fertility. To support the sodium valproate indicators, we recently launched a hub on the AWTTC website. And for the efficiency indicators, the low-value prescribing basket will be updated to remove Tadalafil, although it will continue to be monitored on Spira low-value prescribing dashboard. Additionally, chloral hydrate, rifaximin, and almemazine will be added to the basket. I'll now pass over to Kat, who will go through the new Spira dashboard.
Thank you, Shayla. So, once these new indicators have been introduced for 2025-28, they will be added to the 2 existing dashboards that we have on our Spira dashboard, National Prescribing Indicators and the MPI reporting tool. Please note that currently only users who are on the NHS Wales network are able to access Spira dashboards. As Shayla mentioned, we have created a separate OME dashboard as this data is not available in Casper. This allows you to drill down into practice and preparation level data. In 2025-26, we'll be introducing course duration for RTI antibiotics as a new indicator. Like OME, this data isn't available in Casper. Therefore, we've developed a new dashboard for this data, and this is what I'm going to run through now to give you an idea of what is included. So on the first tab, we have a user guide, which just contains some useful information about the dashboard. On the Summary tab, users can use the filters at the top of the page to select period and antibiotic. Users can also choose how they want the data to be grouped, health board, cluster, or practice level. The first bar chart shows the data by health board, the next by cluster, then practice, and then the last one shows the data over a period of time. And this is the one that is grouped by the selection you have made at the top of the page. So in this case, health board. So, for example, if we wanted to look at clarithromycin prescribing in how or thou, then we can select clarithromycin and click on the how or thou bar. This will then drill down and only show clusters and practices within how or thou. You can drill down further by just selecting one of the clusters. As you will see, the graph at the bottom still only shows a single line representing how or thou health board. However, if we go back to the top and change our group by option to practice, we now see a separate line for each of the practice within our chosen cluster. You could further limit it to just show a line for one of those practices if you wish. Once you've got it displaying the data you like, or once you have finished, you can reset your screen at any time by scrolling to the bottom left and clicking on the Reset View button. Alternatively, you can just refresh your page. The summary change works in a very similar way, but it shows the change in the measure. It will always select the most recent period, but you can change what you want to compare this against here. So if I change reference date to 2023-10, for example, it will now show me October 2023 versus October 2024. You can switch your antibiotics here, and the graphs are shown at health board, cluster, and practice level. The health board drill down enables users to export data for their own analysis. It shows the percentage being prescribed, as well as the numerator and denominator. And again, you have the options to filter by period, health board, and antibiotic. You're also able to drill down further to cluster and practice level. So, for example, if you hover over health board and click on the plus sign, this will bring up cluster data. You can do it again to drill down to practice level. You can then export this data for you to use. However, this will export the data for all health boards currently. If there's only one that you're interested in, you can use the filter at the top to just show that data that you're interested in. You can then scroll to the bottom, click on the rectangle and select cross tabs. You can then select which format you would like to download your data in and click on download. The Health Board Summary tab presents the data in a different way. For here, percentages are shown for each of the 3 antibiotics for the period you've selected. There is a plus symbol on the table, which again will allow you to drill down. So I can select it to expand to cluster, but as you can see, there's currently too much data for this to be displayed on the screen. If you were to export the data, then you would be able to see it. Alternatively, if you're only interested in a single health board, you can click on their name and select the Keep Only option, and the data will then appear. The same applies if you want to drill down from cluster to practice level. You can expand it, select just a cluster, and Keep Only. And again, the data now appears. Once you have selected the data you would like to use, again, you can use the options at the bottom to export the data. Please bear in mind that when you're using the Keep Only option, this can affect data displayed on other tabs. So once you have finished, make sure you reset your view or refresh before moving on to something else. The next 2 tabs contain box and whisker plots. The first one is by health board. It contains the same filters as before. These plots show variation between practices within a health board. Each circle represents a practice, and you can select multiple periods to show changes in prescribing over time. You can change which antibiotic you want to look at, and again, you can select to show all health boards or just one. The next one is the same thing, but it just shows the data at all Wales level. The final tab shows trend lines for health boards. The top one shows 5-day prescribing as a percentage of 5 and 7 days. Depending on what you report, though, it may be useful to show 7 days as a percentage of 5 and 7, and that's shown in the second graph. There is also the option on this chart to change the denominator. The default denominator is 5 plus 7 days to match the indicator. However, say for example, you wanted to look at 5 days doxycycline prescribing versus all doxycycline prescribing. You can change your denominator here to all, and the graphs will update accordingly. This dashboard is live on Spira now, and we hope it will be useful and it will help support health boards prepare for these new indications. Thank you.